Kidney failure, also known as renal failure, is a serious medical condition where the kidneys can no longer effectively filter waste products and excess fluids from the blood. Patients with kidney failure may experience a range of symptoms, such as fatigue, swelling in the legs and hands due to fluid retention, and reduced urine output as the kidneys lose their filtering ability. Other signs include nausea, shortness of breath, and high blood pressure, which can indicate a buildup of toxins in the body. Treatments vary depending on the severity and may include dialysis, which artificially removes waste from the blood, or a kidney transplant for eligible patients. Common risk factors for developing kidney failure include diabetes, high blood pressure, chronic kidney diseases, and prolonged obstruction of the urinary tract. Here's a closer look into the intricate aspects of the disease. Onset speed, acute versus chronic. Kidney failure, a critical reduction in kidney function, manifests in two main forms: acute kidney failure, AKF, and chronic kidney failure, F. Acute kidney failure strikes rapidly, often due to sudden events like severe dehydration, drug reactions, or trauma, leading to an abrupt halt in the kidney's ability to filter waste. Its sudden nature means it's usually reversible with swift, appropriate treatment. Chronic kidney failure, on the other hand, creeps in over months or years as a result of progressive conditions such as diabetes or high blood pressure. Unlike AKF, CKF is irreversible and treatment focuses on slowing progression, managing symptoms, and ultimately may require dialysis or kidney transplantation to replace the lost kidney function. Understanding the onset speed is crucial since it dictates the immediacy of care and the long-term management strategies for kidney failure. Primary system involved, renal versus therapeutic. Understanding the dichotomy between kidney failure and its treatment demands recognizing the delicate balance of intervention. Kidney failure, often a consequence of conditions like hypertension and diabetes, ultimately culminates in the kidney's inability to filter waste effectively. Signifying a renal system collapse, its indicators include elevated creatinine and urea levels alongside diminished glomerular filtration rates. Contrastingly, the therapeutic dimension encompasses methods like dialysis, which substitutes for the filtration function, or kidney transplantation, offering a more permanent solution. Treatment effectiveness is contingent on timely diagnosis, with both hemodialysis and peritoneal dialysis managing waste accumulation, but differing in mechanism and lifestyle impact. Transplantation, while ideal, introduces complexities of organ compatibility and rejection. Hence, the therapist's role becomes critical in maneuvering these medical intricacies to restore balance and homeostasis within the body. Nature of condition: pathophysiological versus interventional. Kidney failure, also known as renal failure, is a condition where the kidneys lose their ability to filter waste and balance fluids, leading to dangerous levels of waste accumulation in the body. Pathophysiologically, it can be acute or chronic, stemming from direct kidney trauma, reduced blood flow, or diseases like diabetes and hypertension. Chronic kidney disease, CKD, develops over years and is irreversible, often resulting in end-stage renal disease, ESRD. Treatment initially focuses on managing symptoms, slowing progression, and addressing the underlying cause, if there is one. As the condition advances, interventional treatments such as dialysis, which mechanically filters blood, or kidney transplantation become necessary to sustain life. These intervention strategies aim to mimic or replace the lost kidney functions, highlighting the body's urgent reliance on artificial means or organ transplants when organic systems fail. Treatment approach: supportive care versus active management. Kidney failure, or end-stage renal disease, ESRD, signifies a critical decline in kidney function where the organs fail to filter waste from the blood effectively. Managing this condition can range from supportive care, focusing on alleviating symptoms and enhancing quality of life without aggressive interventions, to active management, which includes more definitive treatments. Supportive care may involve dietary modifications, medications to manage complications like hypertension and anemia, and dialysis to replace some kidney functions. Meanwhile, active management escalates to potential kidney transplantation, offering a more permanent solution but requiring substantive surgical intervention and lifelong immune suppression to prevent organ rejection, addressing the core issue rather than just mitigating its symptoms. Outcome focus, disease progression versus recovery enhancement. Kidney failure, a critical outcome of various underlying conditions, implies the kidney's inability to function adequately. Progression of this disease leads to accumulation of waste products and fluid imbalances, severely impacting overall health. Treatment options depend on the stage of kidney failure, falling broadly into two categories: dialysis, a life sustaining intervention filtering blood artificially, and kidney transplantation, a more definitive but resource intensive solution introducing a healthy kidney from a donor. Recovery enhancement focuses on interventions to slow disease progression, like managing blood pressure and diabetes, which are key factors contributing to kidney damage. Lifestyle modifications, coupled with medications that target kidney specific pathways, offer hope for stabilizing kidney function and enhancing patient quality of life, emphasizing preservation over replacement of kidney function.